Treating and managing ovarian cancer. Your ovarian cancer treatment plan should be customized based on the type, location, and stage of your cancer, your age, whether you plan to have children, and your overall health. You and your doctor should share decisions about your treatment plan. A gynecologic oncologist specializes in caring for women with cancers of the reproductive organs. Studies show that women with ovarian cancer have better outcomes when a gynecologic oncologist who does many surgeries performs their cancer surgery. Ask your doctor for a referral to a gynecologic oncologist. For ovarian cancer, the goals of surgery are to find out the cancer stage or how far it has spread, and to remove as much of the tumor as possible. This is called debulking or cytoreduction. Ideally, all visible tumor is removed. The type of surgery performed will depend on factors such as the cancer's location, the type of tumor, and the patient's age. Surgery may include removing the uterus, one or both ovaries, or one or both fallopian tubes. If you want to have children in the future, ask your doctor if fertility-sparing surgery is an option for you. Menopause is the time of life when your menstrual cycles stop. For many women, natural menopause occurs in their early 50s. If you have surgery to remove both ovaries before you've entered natural menopause, the surgery will cause you to enter menopause right away. This is often called surgical menopause. Common symptoms of menopause include hot flashes, mood changes, and changes in sexual function. Menopause also increases your risk for bone loss in the future. Before you have surgery, ask your doctor what can be done to treat symptoms of menopause and protect your bone health. Chemotherapy, or chemo, uses anti-cancer drugs to destroy cancer cells. Chemo may be given before surgery to shrink the tumor and make surgery easier, or after surgery to kill any remaining cancer cells. Patients with ovarian cancer most often receive combination chemo with 2 or more drugs that attack the cancer in different ways. Chemo for ovarian cancer is usually injected into a vein through an IV. In select cases, it may be heated and injected into the abdomen either during or after surgery. This is called hot chemo or HIPEC. Cancer starts when abnormal cells grow and multiply without stopping. Targeted therapy uses drugs that attack these abnormal cells to stop the cancer from growing or spreading. PARP inhibitors, which we will discuss shortly, are a type of targeted therapy called maintenance therapy, used to treat ovarian cancer. Other treatment options for ovarian cancer include hormone therapy, which uses hormones or hormone-blocking drugs to kill cancer. Radiation therapy, which is less commonly used to treat ovarian cancer, uses high-energy X-rays to kill cancer cells. And immunotherapy, which uses the body's immune system to kill cancer. Researchers are studying how best to use immunotherapy to treat ovarian cancer. Clinical trials are studies of new drugs or procedures in people. They are used to test whether new medications are safe and more effective than existing ones. By enrolling in a clinical trial, you may be able to get a new treatment for ovarian cancer before it's generally available. Ask your doctor if enrolling in an ovarian cancer clinical trial is right for you. After you complete chemo, your doctor may prescribe maintenance treatment to prevent or delay a return of your cancer based on your surgery findings or specific testing of your tumor. For example, studies show that when PARP inhibitors are given as maintenance treatment, they delay recurrence in some patients. They may also reduce the risk that cancer will return. Your doctor also will want to do periodic blood tests and scans to make sure there is no evidence of disease. Most treatments for ovarian cancer have side effects that can affect your body, your emotions, and your mental state. Talk with your healthcare team about any side effects you're having. They can work with you to find ways to relieve and manage your side effects. It's also important to get social and emotional support for your well-being. Consider talking to a counselor or joining a support group to help you through this time. Your healthcare team, friends, family members, and others can help you cope with your emotions and guide you on this journey.